Uno. We are on live.
Oh, thank you so much. Hello, everyone. Good afternoon to all of you, my dear patients. Today, I'm overwhelmed of excitement. I'm extremely happy to have a very sensational and spectacular person in this live, Dr. Jonathan Obi Murillo, uh, also known as Obi, Dr. Obi. May the force be with you. In this case, it's going to be may the health be with you. Uh, this is exciting because he's not only a guest for this live, he's now part of the team of Splendid. He is going to be in charge with you on the pre-op, on the post-op. He's gonna do a very interesting work, a new concept. It's not very new concept, but it's a concept that relies on food, relies on exercise, and relies on a concept that this is new, that is being taken in count, intestinal microbiota. Altogether, make a concept that is called metabolic rehab. So Dr. Obi is going to be working. Dr. Obi is going to be working on metabolic rehab in all of you, past, present, and future patients. At the very beginning, we're going to start with the patients of this year, but we are going to explain that later in the talk. In the talk, uh, let's do this. Let's start with this. Please, Dr. Obi, can you tell us who are you, where are you from, where you were hiding these years that I've been doing bariatric surgery? Because otherwise, I would have you here before. So please tell the audience, tell my patients, tell everybody that is watching who is Dr. Obi and what Dr. Obi does.
Hello, everyone. Thank you so much, Dr. Zavalza, Dr. C. It's an honor to be here and have the great opportunity to connect with all of you. I'm really looking forward for sharing some insights. More importantly, learning from your experience also. The My background, I'm a medical doctor, and I'm also has a master's degree on sports, on sciences on sports. I've been working with Mexican Olympic Committee. I have the great honor to be part of the Mexican team from the Beijing 2008 Olympics. So since 2010, I've been working with not from the sports science. I've been working with metabolic patients, like obesity, like diabetes, like metabolic syndrome. I put my knowledge into the health of the people to recovery fast, the athletes, also recovery fast for the people. So that's the my a little of my background that I was working it.
Okay, terrific. So impressionate background. You're didn't mention, but you were also participant in several books. You have written some chapters in several books of the Mexican of the Mexican board for bariatric surgery, and that is fantastic. And you're also a teacher from a university, so
Yeah.
you teach the new doctors, so that is fantastic. Uh, let's start today, Dr. Obi, with the preparation of the patients, because it's not just the preparation of the patients, it's the preparations for any people that wants to be healthier. So there is always a new opportunity for the people that wants to be thinner, that wants to be healthier people preparing for the future, preparing for a healthy longevity, preparing for a pregnancy. So all these type of things are a huge areas of opportunity. So in this case, we're going to work in three important fields, which is the preparation of bariatric patients, the preparation of plastic surgery patients, and the follow up of all of my patients. So, but can you tell us a little bit why is important to prepare metabolically for life, for a pregnancy, for the surgery, and what did you accomplish by preparing in this area, please?
Yeah, thank you. The preparation for the body to function well is let me use an example, right? Let's talk about some kind of field. If you want to plant some fruits or some veggies or anything you can grow, the very first thing you should do is to prepare the ground, right? Prepare the soil.
Yeah,
Fill the soil with nutrients. Prevent pests from appearing in the soil where the roots will growing, right? So the human body is your biological terrain, your biological field. You need to prepare and care for it consistently, daily, before and after surgery to live long and healthy life, where you can start to preparing that biological field, where it everything starts and related to the gut, your gut health, your stomach, your intestinals, um, working together with your neurological system and your immune system. So it all begins in the gut. The inflammation begins in the gut. The health begins in the gut. So the digestive system, the nutrients, what do you need to absorb from the eating to bring energy for your all your cells, your nutrients needed to repair tissue properly, and the regulation of your immune system. More than 70% of this happens in your digestive system, in your intestines. So if you have digestive symptoms before any surgery, what symptoms like bloating, heartburn, reflux, constipation, or any stomach or bowel symptoms, you have to fix it first. There is where pre-op diets come into play. It depends on your particular case and the supplements you'll be using before surgery, but it's a very important thing that if you are going to have any surgery, if you are preparing for, like you say, like for a pregnancy, or if you only want to maintain your weight or become healthier, um, and longer, um, uh, I'll- you you want to live longer. So the
increase the
best,
life like increase life expectancy in order
yeah,
to increase life
increasing
expectancy.
in order to increase life expectancy, but also not only the life expectancy. The life expectancy, you can live many years connected with the machines, right?
Gadgets, machines, yeah.
Yeah, but you want to live longer, but be well. So that's the we were looking for that kind of longevity.
Yeah, a healthy longevity,
Yes.
because ain't no matter you live 100 years and 20 or 30 of those years you're in a wheelchair, you're bedridden, someone needs to take care of you. So the final idea of this is that the patient is able to take care of themselves. I say this to all the patients, but it's not a very nice word, but I tell them. So the idea is that you, at 1995, you're able to clean your ass by yourself. That
Yeah.
nobody else is doing that. And it's funny. It's so funny because it's true, This thing that is pretty simple at this moment, Dr. Obi, in a person that is in the that has a medical condition that cannot move, that cannot take care of themselves, becomes a huge issue. And I always tell this to the patients too. The patients know this. So the idea, and ideally in an ideal world, is that when you're old enough to die, you walk to your grave. That nobody has to take care of you. So you go there and you put it there and you go to sleep and you go to the eternity. So that is a fantastic thing because many of the patients, they have a problem, Dr. Obi, that they don't lose enough. One thing. Second thing, they lose but they regain.
Yeah.
Third thing, they don't prepare well and they have a complication. It's much more harder to get them out from that complication. So all these type of things uh, are well the patients need, and that's why we invited you to this live, but also to the team because I know that you are gonna put all your knowledge and all your effort making this to happen. All right. So I interrupted you. I'm so sorry because I'm really excited.
No, no, I'm really excited too, and I'm really honored to be here and bring my knowledge for your team, for your people, for your community of Splendid.
Okay, terrific. So then the biggest thing. Let's start for two things. A patient got a weight loss surgery. They do fantastic. They do terrific. Patient lose all the weight that they want to lose,
Mhm.
and they always ask me, which surgery should I get to prevent weight regain? Or once they lose the weight, they forget about doing the habits that took them
Mm.
into success, and at some point they start regaining weight. So please, Dr. Obi, what a patient should do to prevent weight regain, to maintain the weight, or a patient that lost and start regaining, what this type of patients can do, or what metabolic rehab can do so we can avoid this, because this is a big issue. It was a lot of success, it was very successful surgery, but though I regained it, I went into a hard time of life, a family member passed away, I went into a divorce, I lost my job. So stressful situations, family dynamics changes, or just simple that you're trying to make a living and you don't have the time to cook and stuff like that. So how a
Life
patient
happens. Life
life
happens.
happens. That is the thing. So what a patient can do about this?
Yeah, let me say hello to Heather that is here on Facebook. Hello, hello, Heather Fisher. I don't know the name, but I think it's Lilith who is seeing us in YouTube. Sorry, we're late. Sarah and Alona checking in. Hello, Sarah and Alona. Hello, hello everyone. So, okay, let's going to ask your question, right? Preventing weight regain. That's a real issue. So it's very important for every patient or future patient, pre or post op or any people who are looking for that healthy longevity, that they need to understand the the lifestyle changes. One of the biggest challenges of the people face uh, is preventing that we sometimes we can address proactively, um, like a patients. The main approach is three main areas, right? One is physical activity. It's a very important thing to work. The second is nutritional, that has to do with the gut microbiome. That we'll talking about that later. And the third thing is about, you already mentioned it, is about is stress control, right? Because hormonal change are like a cortisol, and that can change a lot of the metabolic way that happens in between the body. What is metabolic? is the capacity of the cells to take um, sugars, to take proteins, to take fats, and use it as a source of your own tissue, like muscles, or use it as an energy resource. When anything happens between that kind of transformation, that you can uses your glucose as a source of energy, or you can use the food intake protein like a source of your own muscle, that's the metabolic alteration. That's why we apply metabolic rehabilitation, right? So physical activity is it's very important, because if you not are not going to the gym, it's okay. My main goal with the physical activity is uh, you can use effective exercise. You can do it in home, or you can do it in your and your everyday activities. But this exercise is not just for burning calories, like a lot of cardio, like a walking a lot, or just walking in the park, or riding a bike a lot of time. These exercises is about improving your posture, like your shoulders, your knee, your neck, your your low back. So correcting and improving your posture, you feel more energized, because at the end of the day, if you are working and you having stress, I'm pretty sure you take your neck and say, "Oh, that that day was terrific. I'm stressed out," right? And a lot of that pain in your neck is postural. Is because you are all day you are in that position, right? Your face is forward, your shoulders are rounded, and if you correct that posture doing exercises, you are activated, repairing tissue, muscle tissue, growing muscle, and you are feeling more energized.
Okay, and the idea, Dr. Obi, of exercising, of correcting the postural problems that a patient has, these postural problems are are very part of our daily lives, that we don't see them abnormal anymore. We have adopted those vicious positions that doesn't allow us to function properly. Imagine that the patient has a normal weight with postural problems.
Mhm.
After the patient tries to exercise, the possibility of injuries and these type of problems are going to be much, much higher. So this means, Dr. Obi, that this type of exercise should be prescribed. I mean, it's not
Yeah.
like just go and do cardio, just go to the gym and get a personal trainer. Is you need a prescription? Like if you are gonna
Yes.
prescribe antibiotics or something, so that is prescription exercise. Can you tell us a little bit about this, please?
Yeah. Yeah. Actually, the exercise is medicine. Okay. Exercise is need to be prescribed as a medicine. If you know, like if you take any medications like anti-inflammatory drugs, yes, um, you have to take it by different hours,
Mhm.
like 6, 8, 12 hours. You can take any medications with doses of
Mhm.
milligrams, and the
Mhm.
exercise is it's a kind of thing. If you only walk, it's a physical activity, yes, but it's a low physical activity.
Like
So
low impact physical activity. I mean, it's gonna have a low impact in your muscle. It's gonna have a low impact in your metabolism. It's gonna be a low impact in where, Dr. Obi.
yeah, it's going to be a low impact everywhere. It's going to be low impact for your joints. That's why they use the term low impact. It's not like running or jumping. Okay. It's low
Mhm.
impact on the joints. But if you do not have a stress for that muscle, like you are lifting weights,
Mhm.
your muscle doesn't be grow
Okay, it
or
doesn't grow. It doesn't grow if it means that if you don't put your muscle
uh-huh.
under a good amount of stress, the
Yeah.
muscle is going to remain the same. And as far as I know, we lose muscle with age, right? As far as I know, we lose about 10% of muscle after the 30 years per decade. So it means that by 40 you have 10% less muscle, by 50 you have 20, by 60 you have 30% less muscle. If you don't exercise, plus you're exposed to all these things, the stress, the bad eating habits, am I right? Or
Yes.
there is something?
No, no, no. It's kind of, if you do not exercise with lift weights or stress that muscle, yes, you are going to lose your muscle. You need to put an effort on your muscle, and you can have 50, 60, 70, 80 with the same muscle, or maybe more muscle that you have on your 20s or your 30s, if you doesn't exercise when you are 20s or 30s. You can
Okay,
also have more muscle. It doesn't matter the age, right?
okay, fantastic. And this muscle, I mean, muscles give us the possibility to move. It gives us the possibility to see. It gives us the possibility to go to bed. It gives us the possibility to go to the restroom. Give us the possibility to go to the market, to go to the grocery, to do everything, to lift the grandkids, or whatever. So that is fantastic, because without muscle we cannot move. Every movement we do it through muscles,
Yeah.
and that is fantastic. So you are going to prescribe patients exercise. So you're going to let them know you need to do this or you need to do that. And you also mentioned about postural changes,
Yeah.
ambitious postural changes from the patients. So how are you going to evaluate these postural changes? And can you give us an example? What kind of exercise a patient is going to do? Because this is the biggest issue for the patients. Let me be
Yeah.
honest. The first 2 years, 3 years after the surgery is exercise. They don't have feel enough energy. They don't have enough energy to go to the gym. They walk a lot. They do a lot of cardio, all my patients, but
Mhm.
the weight is like a problem because the energy is pretty low after. And in order to gain that energy back becomes very hard and very difficult for the patient. So
Yeah,
can you let me know the type of exercise and how are you going to evaluate the postural changes? Because if a patient has a back injury and you tell them, yo, you need to do exercise, and the patient has a back injury, he's going to tell you, hell no, I'm not going to do that. My doctor told me not to do any of these exercises of a patient with a knee problem, with an ankle problem. Just can you
yeah,
explain this because it might be confusing for the patients.
yeah. I know. It's very contradictory, even between medical doctors, right? Even between surgeon, like traumatology surgeon, with uh, a medical sports doctor, right? We as a medical sports doctor, we urge the patients to move uh, as quickly as we can, and a lot of medical surgeons in another fields is don't move after your surgery. So because the movement um, improves the restorative cells, improve your immunological system, so you can recover fast. So that's why you need to do a exercise prescription, personalized, like you say. If I'm having a back pain, or I have a, um, history of any medical conditions that the other doctors told me do not move, we can evaluate your medical record and prescribe even exercise that you can do seated, or you can do laying in your bed. So it is for your recovering, for your rehabilitation. And also the exercise is very important for the people who wants to lose the fat. I also like much talking about losing fat and not losing weight, because if you gain muscle, you gain weight. But if you lose fat, you also lose weight, but maybe you gain more muscle and you gain more
I
weight.
mean, means that the composition of your body changes. I mean, you lower the fat and increase the
Increase them.
muscle, and that
Yeah,
this is the reason why the patient don't lose weight, but they lose inches. They say, I fit better in the clothes, but
yeah,
doc, I didn't lose any. But they start feeling better. They feel less bloated. The abdomen is plain. So this is the reason why.
yeah. That's the reason. Um, every patient who's doing the exercise and doing any changes for the lifestyle
Mhm.
also feels very well. But it becomes to look at the scale and, oh, I didn't lose weight.
They
You
discourage. It's very discouraging, and I
Yeah,
always fight against this against the patient. So hide the scale. Don't go to the scale so often, because the scale can be a great
yes,
friend, but it can be your worst enemy because it's frustrating. Some patients, the scale hasn't moved in 2 weeks, 3 weeks, 4 weeks.
yeah,
So this, if you're following the process, if you're embracing the process, means that being not being not losing weight is not that bad if you're following these rules.
yeah, yeah. And that's why we are looking for that.
Okay, so we are looking at it because the rapid weight loss is not even good, right? It's because if you lose weight, you can get
You
into
lose
some
everything.
really.
You lose fat. You lose muscle. You lose your tissue, like your skin, like the collagen of
So
in the skin.
that's why some patients that get a weight loss surgery, that they don't follow the rules, they look sick. They
Yeah,
look at the
that's
hanging
why.
of the skin. They look like
Absolutely,
very very thin hair. Is because they are not following this type of
absolutely.
these
Yes.
advices. Is that right?
Yeah.
So thanks that you are gonna be with us, because you're gonna help us a lot, a lot, a lot. So going back a little bit and put everything into perspective, we are looking for the metabolic rehab. And metabolic rehab says includes exercise, prescribed exercise.
Hmm.
The second one is nutrition, I mean proper food intake. And the
Yeah.
third one is intestinal microbiota. We're going to move now to nutrition and
Uh-huh.
intestinal microbiota. Just let me tell you this to my lovely patients. Dr. Obi lives in the very south of Mexico, so he
Yeah.
doesn't practice a lot of English. So he might be a little bit like here and there, because he has so much knowledge that as soon as he can practice more his English and stuff like that, he's gonna be able to share all his knowledge with us. The first time I talked to him, the first time I saw him, I was so impressed with all the knowledge. We used to do that, but the deep of the knowledge and the deep of the interventions with the patients, with you all, is going to be terrific. I just need to start talking a lot, a lot, a lot in English with him,
Yeah.
and because I can see you're a little bit frustrated at this point and at this moment, because
Yeah. Thank
I
you
know
very
you
much.
want to say that you want to say a lot of things, that a lot of things comes to your mind, but that is a language barrier that we are going to defeat for sure in a very short period of time. Besides that, you're going to be doing the patient's evaluations pre-op, post-op. We're going to recover patients from the past, and we're going to create the best follow-up program. I think first in Tijuana, then in Mexico, then in America, and maybe we're going to be top programs in weight loss surgery, in plastic surgery, and weight maintenance. So we're working a lot. We are have really really good plans for you all. So you're going to
Thank
be
you.
thrilled. All of the patients, you, me, the part of the team, we are very happy because we know that the patients need this, and we are not going for the surgery. We don't give a lot of importance Personally, I don't. It's important, but it's not that important as surgery.
Thank
Surgery,
you,
in
thank
my
you, thank you
opinion,
very much. Right.
and you will agree with me, Dr. Obi, that the surgery is the last important part of the process. I think what you do around the surgery is much more important. And the idea is to share the patients this information.
Mhm.
The patient becomes very knowledgeable
Mhm.
and an educated patient. An educated patient is going to know, Dr. Obi, why is not losing, why is it regaining, how to prevent it, that only going back a little bit, being calm, and start this metabolic rehab because you're going to be educated, the weight is going to come off. So that is the idea. But sorry for interrupting you. I'm excited. As you can see, I'm excited. Can you tell us a little bit how is the nutrition in metabolic rehab and what intestinal microbiota does for us in a few words, please?
Yeah, yeah, I do. But also, I just want to say hello to Marvin. Yeah,
Oh, Marvin.
Marvin. Yeah, hello, hello.
He's one of my former patients. So
Okay,
hello, Marvin, from
hello,
Facebook.
Marvin. Yes, on Facebook. On Facebook also, Ale Padilla. Hello, Ale. Hello, Ale.
Ale Padilla speaks very good Spanish. Ahí hablamos súper bien español. Estuvo con nosotros hace poquitos semanas, meses. Ale, te vamos a poner en contacto con el doctor Obi. Él te va a ayudar. Recuerdas que estuviste en contacto acerca de tu ejercicio y del bootcamp en el que estabas. So, el doctor Obi te va a ayudar y vas a ver que vas a volver a perder el peso que tú
Okay.
quieres. ¿Ok?
Thank you. Thank you. Thank you, Ale. Lori also. Lori, hello. Also,
Oh, Lori, Dr. Obi is a
yes.
future patient.
Okay.
We deny his surgery the first time we come because we find a problem in the endoscopy. But this time he's coming, so it's going to be your patient. It's going to be our patient. She's a very, very beautiful patient, and she will get a lot of the benefits of this metabolic rehab. Okay,
Yeah,
so you
we
will.
are in a few minutes. We will talking about the pre-operative nutritional and microbiome, right?
Okay,
So let me say hello. Also, Vicky
Vicky,
Flagship Colson. Hello.
Blankenship Olsen. Blicky, she's one of my former patients too. We hope you share this that is happening here.
Yeah,
We're becoming better and we're gonna do much, much better for you all. Hi, Vicky.
yeah, and Heather, thank you very much for your comment. He's fine, no problem understanding him. Thank you very much. I really appreciated that.
I know Dr. Obi. He wants to say much more things,
Yeah,
but
a lot.
a lot of things are gonna come out of his mouth, and everybody's gonna shut out
Yeah.
that. You will see that.
Yeah, Laura, this is wonderful. Okay,
Laura,
Monica say hello, and Miss
good
Davis,
morning.
Dr. C. Um, my surgery, will I be eligible for a metabolic evaluation? Yes,
Okay, Missy, of course, all the patients. We're gonna contact all my former patients,
yes.
and we're gonna create like a group program where everybody can join it here, and we will have some stats at the very beginning, and we're gonna check for those stats after 3, after 6, after 12 months. Okay, so Dr. Obi, any more comments from our patients that
Yes, yeah,
we
yeah,
want to
yeah.
share?
You're here from Dr. C, all bundle up, and I am here in night sweater in shorts. Okay.
Oh, well, that is fantastic. That is fantastic. So
Yeah.
the idea, this is all about.
Okay.
This is this is what is about all life, and it's
Okay.
enjoy. That you're
Look,
able to go and get a suntan and be with your family and stuff like that. So continue, Dr. Obi. I'm sorry, I
no,
interrupted
no.
you.
Look at the comment from Kimberly. Hello, Kim from Splendid is here. I need you, Dr. Obi. You are speaking my personal history, my personal story. Right.
Okay. Well, so Dr. Obi, you're gonna be very, very busy. So you'd better to have a lot of energy and good food. So because a lot of patients will ask for your evaluation. I'm gonna be in the evaluation. I'm gonna be in the sessions, in the group sessions too. So the idea is that if you regain some weight,
Uh-huh.
you can lose it. If you didn't lose, you can lose it. You can lose it at this point. Let me ask you one question before going to nutrition and microbiome. Well,
Yeah.
Trinidad and
Yeah, this
Sabrina.
is Trinidad. Is I'm on a year and a half out fixing to have my gallbladder out, but I have a bad knee and plantar fasciitis.
Fascia-
Oh no,
Fasciitis. It's fasciitis.
yeah, yes,
Fasciitis.
plantar fasciitis. Yes, yes, fasciitis plantar. Uh-huh. So how can I keep losing weight? Okay, yeah. We will work in with you also, Trinidad,
Okay, so three things: eat, exercise, and intestinal microbiome. We're gonna let
and
everybody to
stress
know.
and stress control.
Stress control. Fantastic, fantastic. So,
So you are going to ask me something
okay,
before talking about microbiome.
yeah, it's for example, let's say that I had a surgery 3 years ago,
Mhm.
and I did fantastic, and 6 months ago I started gaining weight. Let's say that I regained 40 of the 110 pounds that I lost after the surgery, and I start getting so worried that I'm gonna gain them all the way back, which is terrific, which is horrible. If you can compare, because you know, Dr. Obi, that GLP analogs are everywhere out there. There's Zapata, you know, all those type of drugs, okay, because we
Yeah.
cannot mention them. Eh,
Uh-huh.
those type of
But you
drugs
but you can talk about GLP-1. It's okay.
GLP-1 analogs, those type of GLP analog compounds or these kind of substances, if you can compare a metabolic rehabilitation to a GLP-1 analogs, which one do you think it's better, and why? Why you should go to metabolic rehab, or why you should go to GLP analogs, or are both can be used at the same time? I know you have a lot of things to say.
Yes,
Just
yes.
that maybe this English barrier, this language, but you're gonna practice, and this is gonna be fine in a few months. I was at the same spot with you when I started talking to the patient. I was one or two words, but just a comparison between these GLP-1 analogs and a good disciplined metabolic rehab. Tell us which is the difference and which one will do better for the patients.
Okay. First of all, I want to let know to everyone that you also have GLP-1. So if that doesn't blow your mind, I don't know what are going to happen, because your your intestinal cells have the capacity to produce your own GLP-1s. Okay? First of all,
So you have so you produce it. You have all those GLP analogs. I
yeah,
know that you produce it.
that
What
the term or the word you use analog is because it's like you GLP-1, but is
similar
yeah, but it's exogenous, right?
exogenous? Okay, and how do you stimulate your intestinal cells to
That's
produce it?
that's the that's the key. That's the key. So how you stimulate your own GLP in your intestinals, in your line of your cells from your intestines. Um, you have cells called L, like the letter L cells. Okay, so that cells, it's like a scanner. If you're going to any kind of a store, like Walmart or something, when you buying stuff, the cashier is scanning your products, right? So 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 they know they know what are you charging for. So your own gut system has like this scanner. So when you intake is from starches, sugars, some kind of a thing in your intestinal, is like that those scanner. It says to your brain, and it says to your organs like your pancreas, what are your food intake, if you are taking sugars, if you are taking proteins, if you are taking fats. Okay,
This is,
so
let me interrupt you a little bit because I'm getting excited.
yeah,
So
yeah,
this means that this is the way your intestinal cells knows what are you eating. So it's
yes,
like they know, hey, you're eating this, you're eating that. This is the way they communicate in between. So if
yeah,
you eat
the
sugar,
communication in the body is like electricity with your neural system, and chemical way, like the hormones in your body. So
oh,
GLP-1 is it's a hormone, right?
it's a hormone, it's a chemical signal. So
Yeah,
your body interacts with the environment and within themselves, with between the organ and cells. There are two ways to communicate in between. So means electrical impulses, electrical communication. That
yeah,
is one, and the second one is chemical
chemicals.
communications. In the chemicals are hormones, and GLP-1 is a hormone,
Yeah,
and this is the way this our intestinal cells
and
know what are you eating, so the body can respond
yes, and the
to that.
GLP-1, your natural GLP-1 stimulates insulin secretion.
Okay, good.
So it's like if you eat some sugars or starches, your natural L cells from your intestinal sends GLP-1, so it stimulates your pancreas to liberate the insulin and stop producing the opposite of the insulin, that is glucagon.
Okay, fantastic. So
So
that's
and
interesting.
has another function, that is slows the gastric emptying, so promotes satiety.
Promote society because it makes that the food stays in the stomach
Yeah,
more time,
more time.
and this keeps you full for longer time, so you eat less, and that's why how this decrease the intakes. Doc, can this be related to the problems that GLP-1 analogs cause, that they cause some sort of
Totally,
something
totally.
like obstructive symptom like ileums, because it decreases the intestinal mobility,
Mobility. Yeah,
decreases the gastric emptying, causing a
totally, totally.
society that society lasts for longer. So that's
Yes.
why these type of patients don't have a lot of hungry. Is that right?
Yeah, that's right. That's absolutely
Okay.
right.
So we have a scanner. We don't know that we have a scanner, so we cannot cheat that scanner. What you eat is the way those cells respond, and this is the response we get. Is that right?
Yeah. So you have your own chemical produce, like GLP-1, and also you produce the leptin, that is another hormone from your fat cells, that also produce satiety, right? So if you understand how physiological way to promote that, you can improve what your own body can do.
Means that you can make means that you can control the weight. Means that you can
Yes,
control how you function. Means that you can control your physiology.
if you
Means
know how you function, you can control it.
so, and we're going to work on educating the patient and knowing this. You know, if a patient knows what's going on, if the patient know what stimulates the patient to gain weight, if you will let the patient to know. So we're going to create this program, right? We're going to
Yeah,
create videos. We're going to create a lot of content that talks about these topics, so the patient is aware and knows why they're gaining, why they are gaining weight, why they are not losing. So, am I right? what we're gonna
Yeah,
do.
because all the patients, all the people is frustrating because we are living on the on the knowledge, la era de la educación.
Yeah.
How was
Education era, like yeah, era. I
yeah,
think
like, uh-huh, um, you having all the information right on your hand with the internet. So, but it's very frustrating and confusing that in one hand, you find something that they call is good for you, and on the other side you you read or that that same thing is the opposite and is bad for you. So the people doesn't know what to do.
yeah,
But
but it's confusing. You have a lot of opposite information
yes,
about the
but
same problem, and
if you were are working on understanding that physiology, that
it
confusion
won't be.
goes away.
There's not gonna be the patient do wrong.
Yeah.
So if the patient knows physiology, if the patient knows what's going on, what's happening, so they will know why they need to do this. So it's a matter of discipline. It's a
Yes.
matter of doing it for a certain amount of time, certain period of time, depending on the medical background, of course. So you
And
can see the results. Is that right?
yeah, and change is not about discipline. It's about decisions. If you know why you need to do the things we are recommend to you, if you know why, it's your decision.
Yeah.
It's not
But
discipline. It's your decision. If you are, if you want to live longer and going to your 70s, your 80s, your 90s by yourself, that or you're deciding right now doesn't have that kind of healthy living.
okay, so it's the choices from today are gonna be the rewards from tomorrow, or the regrets that it can be something very very big. So that is fantastic. I like that. And
Uh-huh.
we both are going to work on giving the patients all the tool, all this information.
Yeah.
You're going to be doing the pre-op evaluation, post-op evaluation from the patients. You're going to be prescribing the exercise. That is fantastic. Let us move this, because I have another few topics that I need to talk to you. Tell us, how is the nutrition? How is nutrition? Overall speaking, a few words. Let's try to be concise about this. How is the nutrition in metabolic rehab? What is different in this nutrition from the nutrition that they mention in a post-op diet, in a preparation, in a pre-op diet? How is nutrition in a metabolic rehabilitation, please?
When we are talking about only nutrition, we are focused on the nutrients, by the way. We are focusing on carbohydrates, on lipids, on proteins or amino acid, and vitamins and minerals. Right? It's
That is nutrition, right?
That's in
You have
nutritional focus. Yes,
we have the
but
macros. We have the macros and the micros. So the macros are
yes,
protein, fat, and carb,
uh-huh.
and the micros are all the vitamins, all the supplements like zinc, magnesium, and stuff like that. Just to be clear, right?
Yes, this is the nutritional focus. But you have to need gut a gut health for everything you eat. You need not not only eating. You need to process it. You need to absorb it, and you need to do the your own health, your own body take the capacity to produce what it needs to produce. Like you can eat meat, you need to break down the meat to the very minimum that is the amino acids, so your intestinal can absorb it, and you need to have the capacity to use that amino acid to produce your own muscle or your own repairing tissue. It is not only for taking the food.
It's not just to eat, it's just to prepare all the machinery in your body so
Uh-huh.
you can get the most benefits from every nutrients. Means that you can eat all the proteins in the world, and if you are not prepared to absorb it, means that you're gonna lose it, that you're gonna poop it, and that it's gonna go away.
Yes.
So you need to know exact amounts, and you need to prepare. How do you prepare? How do you prepare your body machinery to absorb
Okay.
and utilize these nutrients?
So that's where it comes to here, the microbiome. That is the little microorganisms to live in our own intestinals. So
Okay, so microbiome are all the bacteria, viruses, and fungi we have in our intestines all together. Uh, Participate in your health, participate in the absorptions, participate in the processing of the food. So you're talking about the bacteria, the fungus, and all those bugs that we have in our intestines. Those are the ones that they are not good. We can not utilize the nutrients properly.
yes,
Is that
of
right?
course, is that right?
So
So
you feed so you feed the bacteria so they work in your favor.
yes,
So it's what is
it's a symbiotic
symbiotic
way.
relationship. So what
Yes.
do you eat? So what are you doing? Just giving some food to my bacteria, so to my bugs. So what do you? So can you tell us a little bit about
Yeah,
that? That's interesting.
first of all, you need to know that is we are quoting that, but is good bacteria and bad bacteria, right? So the good bacteria with this symbiotic way to
Relationship.
work. Uh-huh. If you feed the good bacteria it's going to give you the their own products that is going to be good for you.
So
Uh,
these bacteria, their waste products,
their waste bacteria products is good for you.
it's good for you. And the
Yes,
bad bacteria, the
it's
waste
bad for
bacteria
you. The
products,
bad
it's bad
bacteria,
for you.
the bad bacteria produce waste that is the inflammatory way to your bowel, to your intestinal,
Trigger
to
it's the trigger of inflammation that is
yeah,
related to obesity. So the trigger of inflammation and the
yes,
beginning of inflammation that an obesity patient has starts in the gut because you're feeding the bad bacteria.
yeah.
Terrific.
It's the last reviews and the investigation over the world says if you have inflammation that begins in the gut, in your bloodstream, it change the metabolic way that you are on in every part of your
So
body.
your
So
metabolic
it's
state is related to the shit that a bacteria produces. Is that
yes,
right?
yeah,
So
it's right.
oh, that's fantastic and terrific. Well, that is microbiome. This is how you can,
Yeah, so if you feed
summarize
the
what a
good bacteria,
microbiome is.
yeah, as if you feed the good bacteria, it reduces your inflammation, and reducing your inflammation, your your cells, also the power shells of your cells, that is the mitochondria. Mitochondria is kind of it's a genetic way, is a bacteria that lives in every cell. So if you feed the good bacteria, the good bacteria are communicating with your power shells, that is your mitochondria, and the mitochondria produce more energy, and your functions is so very well.
So you're energetic, so you don't feel down, you don't feel tired all the time, so you feel with more energy to do your daily stuff. Is that right?
Yeah, that's why it takes more important to look about your microbiome, your gut health, your microbes.
So that's fantastic. So we're gonna explain all these type of things to all the patients, right? You're gonna
Yeah,
be explaining all these type of things to every patient in a protocol, on a pre-op protocol, post-op protocol, and
yeah.
uh,
I'm pretty sure that every patient it's have some knowledge about probiotics. That is
yeah,
this bacteria
me
like
too.
lactobacilli. see, of
Yeah.
probiotics. The prebiotics is what you feed your bacteria. It's prebiotics is like fiber. Okay, the fiber brings food to those probiotics, that is your bacteria, and the bacteria produces the product of waste of the bacteria. It calls it's called postbiotics. It's the called
Okay.
postbiotics. So we are going to introduce to the protocols postbiotics.
Okay, that's fantastic. So because I've seen a lot of prebiotics and probiotics, both, which is the
Yeah,
bacteria with the food in it. But I never mentioned and I never heard about postbiotic, which is the waste products from these bacteria that are beneficial for our health. So in the
yeah.
protocol, you're gonna,
Imagine if you have the very healthy people like the Japanese centenarian, right?
yeah,
You take it a sample of their microbiome and take their products of waste called postbiotics,
postbiotics, yeah.
and you take those postbiotics and give it to some people who has inflammation or who has any kind of
Metabolic problems, you
yeah,
said?
and switch that
So
thing
you
with
switch.
postbiotics.
So it means that you switch the metabolic state from one obese, in
In-
swollen and inflamed patient with a shit from healthy people.
yes,
Is that right?
yeah, is that right?
Oh, that so it means that, well, we're not gonna do that, right? So that you
No, no,
must,
no,
those
no.
products must have some industrialization, some cleaning
Yeah,
up and stuff like that, right? So you
yes,
get just the waste products that are good for the patient. So we're gonna include that in the protocols and the intake of the patients. Is that right?
is that right?
Okay, fantastic. So let's move forward because we're about to go to an hour because there are another two topics that we want to discuss. Of course, we're going to be producing some content. We're going to create a lot of posts about this, and as soon as the patients see that this is working, they're going to be very excited. They're going to be included in the protocol and stuff like that. So that is fantastic. And in the pre-operative protocol, does your job impact on the pre-op protocol? What are you going to be doing? What is going to be done different? Please.
Okay, on the pre-operative patients, the focus is physical and mentally. We are working on reducing that inflammation through the diet and through the exercise, which can make the surgery safer and recovery smoother and faster. This is might
Fantastic.
include that the nutritional plan is rich on anti-inflammatory foods that is going to work as a prebiotic to optimize the gut health. So we also going to introduce the light physical activities to improve the fitness levels without overwhelming the body, because uh, when we are talking about exercise, is the phrase that uh, no pain no gain, right? So
Yeah, all
that's
the time.
we are not going to work like that. We are going to work on the physical activities that improves physical fitness levels without overwhelming the body, right? So the goal is to set the stages for a
Yeah.
successful surgery and a strong
Mhm.
start and the post-operative journey, and it's going to happen more smoothly and more faster.
Okay, means that we shouldn't over exercise.
Yeah,
Over exercising. What happens if you over exercise
if
though?
your over exercise is the same, is your body um, is recognize that as stress. So if you over exercise, you also have high levels or cortisol, and you reduce your immune system and you reduce your response to make improvement in your own tissues.
Oh, that's fantastic. So I understand a lot why those patients says I work my ass in the gym, I kill my ass, and I'm not losing any weight. So
It
this can be a
is
reason
not,
to
it is not how many time you are working on, is how do you have your workout done.
quality over quantity. Am I right?
Yeah, quality over
Okay,
quantity.
fantastic. And you're gonna include in the protocol. So every protocol is gonna be included. So the
Yeah,
exercise
because every patient has different of
level of
levels of
fitness.
fitness. Yes.
Yeah. Okay. So that's fantastic. So, in to start, let's say that all the patient fits to do a workout
Mhm.
routine in their houses with their own body with no problem. Is that right? So it
Yeah.
means there are no excuses. How much average the average time of a working out for these type of patients? How it looks like? Let's say
Depends
15
on the
minutes,
level.
20 minutes.
Depends on the level of the fitness, but you can work on 5 minutes workouts, 5 minutes, 5 minutes, 5 minutes over the day, or you can work to 10 minutes, or you can work 15 minutes. It depends on the physical
But it's
or
not gonna be that exercise. That's why the patients quit, all right? Because they go to
yeah.
a gym, they are involved into very extenuating routines, and
Fir- First,
they
first of all,
discourage.
first of all, the patients don't has the energy. Yes.
Yeah, okay.
Second,
Well, totally.
maybe doesn't want to go to a gym because I don't know. Maybe they fear about being criticized. So that's why I prefer to work on a very secure
And
and
controlled environment, right? A controlled
yes,
environment so they can exercise properly with no stress.
and
They don't feel
without
bad.
any fancy equipment. You know.
Yeah, yeah. So
Uh,
you don't need a lot of these things, right? By the
Now,
way, let me tell you. So, Dr. Obi, you know about this, but we're gonna hire a group of trainers
yeah,
that they're gonna be teaching us the routines. We're gonna create the media. We're gonna create the content, and you are gonna prescribe all those routines to the patients. Is that right?
is that right?
Okay, that's gonna happen on the visit. So that's fantastic. Fantastic, fantastic. Well, let's say splendid. That's splendid, and that is great. Sounds
Splendid.
like a plan. I think our patients are going to be very grateful to be part of an educational program because it's not a surgery; it's an educational program. They're going to have a lot of knowledge, so they will know what to do. That is great. That is fantastic. So the patient,
Splendid.
what say
Splendid.
what the patient what a patient can expect from your evaluation. What is gonna walk out the patient with after the patient gets an evaluation with you?
Wait, during an evaluation, we'll start by understanding your or their unique situation, their medical records, history, lifestyle, goals, any changes that they already facing. From there, we'll create a personalized plan that might
Mhm.
include a tailored exercise routine that fits their preferences and the physical capabilities. Nutritional guidelines focus on the gut health and metabolic support, and the strategies to address a specific issue like posture or muscle imbalance. For those who are post surgery, we also look at how to prevent that weight regain and maintain muscle mass. The key is the personalization. There is no one size fit all.
Okay,
So
that's
uh, that's why we are working on based on knowledge, like a course. So at the end of the course, will be supporting you every step by step, adjusting a plan
okay.
as
That's
needed. So
terrific.
that's the patients uh, that can expect in the evaluation.
Okay, that is fantastic. Well, sounds like a plan. Sounds like I needed to. Sounds like everybody needs to do this. So this fits for all. I mean, metabolic rehab if you
Yeah.
have a metabolic problem. If you don't have a problem, metabolic maintenance, health maintenance, that in my opinion is the same. So just to finish, and after we finish, we can go and see if we have any comments or any questions.
Yeah.
Just to finish, how can you summarize in very, very few words what a metabolic rehab is and what it can be achieved with this metabolic rehab?
Okay, metabolic rehab or metabolic rehabilitation is a personalized and comprehensive approach focused on restoring or optimizing the body's metabolic function. So the primary goal is improve the metabolic health through the interventions that we are talking about. So involving optimized nutrition, uh, including potentially specific supplements about the postbiotics that we are talking about. Implement appropriate exercises and addressing the factors like hormonal balance. And by the way, also all this is for focus on the mitochondrial health, that is the power cell, the power energy source of every cell. So that's the metabolic rehabilitation.
Okay, well that is fantastic. So this topic is gonna be heard a lot. So we're gonna be talking about this in a lot of sessions. We're gonna be talking about how to achieve the goals the metabolic rehab has to give us. I uh, I was gonna I was gonna tell you thank you, but let's see if we have any comments. I read the comments and
Yeah,
we both can comment about them. Okay,
yeah, yeah.
so
So
okay,
let me show you. Okay, that's interesting. Okay, great information, says Megan. Hello, Megan Yamamoto. Great
okay.
information. Excited
Megan
for this.
is an upcoming patient,
Okay,
Dr. Obi. So you will have to be in touch with her shortly, and you please teach him everything,
yeah.
and the results are going to be fantastic and long term lasting. Okay.
Okay, thank you. Victoria Melendez say hello. Very exciting stuff coming. And also Victoria says, what are the best exercises to do 1 month post surgery? It
That's
depends.
fantastic. That's fantastic because she's a patient that had a surgery a few weeks ago.
Okay.
You can use this as an example for her, for example. I can give you
Yeah.
the information from
It,
her
it,
because she's a
it
very interesting patient too, because of the type of surgery we did. Okay.
yeah, it depends on Victoria. Depends on and what are the physical fitness capacity that Victoria has right now. So it depends on the if Victoria has any issues with the feet, the knees, the low back, or the neck. If Victoria has any um, preferring any kind of sports or activities. So it depends, Victoria. Uh, the most important thing is one, you need to be doing exercises that um, retain or gain muscle. But the most important thing is that you are doing it because you love to doing it, not suffering from the physical activities. So that's why it's going to be a journey uh, with you. Right now you can see me um, thing, but it's because my activities right now is with my children's, that I have 3 kids. So I'm working for my physical fitness, going down, up, run, everything, not for sports. But I was a former football player, American football player. So in that time, my priority was a big muscle mass. So
You don't look like a football player, doc.
No, I know right now, no, because I'm very thin right now, but I wait.
You
I
used to be very, very fit with muscle and very, very strong for the
Yeah,
sport that you
I
were
don't know in
practicing, right?
pounds, but I'm going up 20 kilos in pounds. Maybe how
Pounds at
much?
46, maybe.
46 pounds more, but because of muscle. So it depends, Victoria. It depends on what you want for your living, what you want for your life. But um, we're going to work for your muscle recovery or regain or increase your muscle.
Okay, that is fantastic. Means that exercising is not going to be boring. It's
Yeah.
not going to be like a punishment because every time you go to the gym, you go
No,
to the
no,
gym,
no,
it's
no.
punishment to go to the gym. So it's going to be exciting. It's going to be funny. So the patients are going to feel happy to go and exercise. It's going to be like brushing their teeth, like a daily activity that they enjoy. So we're going to
Yeah, look
make
at what Judy says. I need to gain weight. I lost too much. My present. I think
the present
is
weight,
my
the
my
current
present.
weight.
Yeah, my present weight is 103. Okay.
Okay. So it's a lot of help for her, a lot of help for her too, right? So you're
Yes.
going to work with all these type of patients too, right? Thank you,
Yeah.
Judy, for asking this. So keep us tuned. We're going to keep
Missy
you.
Missy is telling us how do I schedule an online evaluation.
Okay, so we're gonna let everybody to know how to do it. We're gonna contact everyone. We're gonna grab all the information from this chat. And the priority is going to be the patients, the actual patients that we did the surgery now. And after that is all of you that contacted us during the live, and you will start changing for sure. So, but no one is going to be out of this good evaluation or this program that is going to be fantastic for your results. Okay.
Yeah. Heather
Any other
Heather
questions?
Heather says so exciting. So we are
Oh,
so exciting too. Yeah.
well, okay. Heather
So
is a patient, a very beautiful and very, very, very interesting patient. The whole of her process with surgery, reconstruction, and everything did it with us. So she's in Tijuana at this point, actually. So everybody's gonna get their evaluation. Everybody's gonna be evaluated, and everybody is going to have a personalized metabolic rehab, and this is going to give you the possibility to be there, to be the to go to the place that the surgery didn't took you there. So
Nana Fab,
very
I'm so happy with my surgery being 2 years now.
okay, fantastic. So if you're happy, means that you got a lot of work to do to maintain this, so you can maintain this health
For life.
for longer, and for a lifetime. Okay.
Yeah.
So Dr. Obi, I think we cover most of the topics. You can do a full program of every topic that we talk about, a full program of exercise, a
Yeah.
full program of nutrition, a full program of intestinal microbiota. It's an endless topic and ongoing topic all the time. So we're going to be working, digesting this and giving it to the patient in a very clear manner so they can understand it, so they can implement it in their life, in their daily life. And I think the results are going to be amazing for everyone. So, well, said this, what I can tell you, Dr. Obi, is first, thank you so much for sharing your knowledge and your time with all of us. We do really appreciate it. Secondly, tell you welcome to the Splendid family. I know that your knowledge is going to be a breaking point in the patient's journeys. What you do is going to make every patient to be different to the rest. This is going to separate the lifetime successful patients from the non-lifetime successful patients. So we're going to be working on the language. There are some not a huge things. The knowledge is from you is not a problem. Just now it's a matter of practice. But from the bottom of our hearts, from the bottom of my heart, welcome to Splendid, and thank you so much for your time today, Dr. Obi.
Oh, thank you, Dr. C, for your honor me with your invitation, and I'm very happy to be here with all your community of Splendid. I'm also very happy to share my knowledge in behalf of the health of every patient and every future patient right now.
Yeah, fantastic. Thank you so much for all of you. Share this video as soon as we finish. You're going to be able to share it everywhere you want to share it. And we're going to be in touch with you. Schedule the bottom part here is the number where you can
Splendid.com.
apply for an online consultation at splendid.com, fill the medical questionnaire, or you can text on that number or WhatsApp. We're going to be there for you all the way. Thank you so much for your trust. Thank you so much for your time tonight. Dr. Obi, again, thank you so much and welcome. And you're visiting us in Tijuana at the beginning of May.
Yeah.
We're going to be very happy to have you here. And we're going to be creating very important and educative content for all our social media and our web page. Okay. Thank you so much again. And see you shortly in Tijuana.
Yeah, see you there, and all of the patients and future patients. Thank you for being here, and thank you for your support. And I promise you, I become better in my English.
Sure, you will. You're going to have a lot of practice. Okay. Have a good one. Have a great evening, everyone.
Goodbye.
Bye.
Bye bye.